Good morning and welcome to the January 13th City Council meeting. I would also like to say Happy New Year. This is our first council meeting of the year. Goodbye 2020, hello 2021. I would like to have Councilman McGee introduce our guest to do the invocation, and then we'll do the Pledge of Allegiance.
Good morning. I'm honored to have a good friend of mine, Pastor Wendy Mason. She's going to come and she's going to lead us in our invocation for today.
Thank you so much for this opportunity to be in your midst. Congratulations again, Honorable Mayor. Our Father and our God, we come before you this day with our heads bowed, but our hearts are uplifted unto thee. Lord, we're living in perilous times, but I know that thou art God, and beside you there is none other. And I pray, Lord, that we will learn how to work together, to walk together, to reason together, and to sit together at the table, Lord, to make decisions that are reasonable and decisions that will improve the life of the men and women in the United States of America. And in spite of what we now see, I know that you rule and super rule. And in times like these, we must realize we need a Savior. We need an anchor. We need to be very sure that you are our Lord and Savior. My great-grandmother used to call you the Great Spirit from the Choctaw Nation. And I say, Great Spirit, bless all of us and keep us. Show us how to get out of party politics and how to be a child of the Most High God and to work together to make the United States of America a better place. Thank you, great God, for this council, this city council of the great city of Tyler. Bless them that they might continue to do the great work that is set before them. And Lord, I ask that in spite of all that's going on, that we will learn how to look to you, the author and the finisher of our faith. This is a great city in which we live. Thank you, God, for showing us that we can work together, that we can sit down at the welcome table one day. Thank you, gracious God, for all who have come. And again, bless this city council, that the men and women of God might continue to make the city of Tyler a great place. And hopefully let us spread abroad and make the United States a wonderful place in which to live. I grew up in this city. I know where we've come from. But Lord, I know you're going to take us where we need to be. In the name that is above all other names, in the name of Jesus, the Christ, I pray. Amen.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Arinthia, don't feel like you got to stick around unless you just want to watch government at work. Boy, you can sure pray, I'll tell you that. All right, first on the agenda is to approve the minutes from October 28th and November the 11th.
Move to approve the minutes as presented.
Got a motion by Westbrook, second by McGee. All those in favor say aye.
Aye.
Opposed? Motion carries. Presentation P1, I guess that would be George. And Dr. McGahey. Good morning, guys.
Good morning.
Good morning.
Morning.
Good morning.
How are y'all doing? Happy New Year.
Happy New Year.
So again, I'm George Roberts with the Northeast Texas Public Health District, and I'm joined today by our Smith County Health Authority, Dr. Paul McGahey, who we've gotten to know. Let me share our updated case dashboard with you. See if we can get that up on the slide there. Here we go. So as of yesterday, January 12th, 2021, we have a total of 14,526 COVID-19 cases in Smith County. Of these, 8,243 are confirmed cases of COVID-19 and 6,283 are probable cases. Our recovered patient count now is 9,615, including both confirmed and probable cases. There are 316 East Texans in Tyler, Texas hospitals as of yesterday. We've had 227 Smith County residents who have passed away from COVID-19. And again, our condolences go out to those families who have lost a loved one due to COVID-19. So now, I guess as of today, this is our 10-month anniversary of the date that we announced our first COVID-19 cases in this particular room. Friday, March 13th was the day. So where are we now? Well, again, as we said before, we may be tired of this virus, but it's not tired of us. So, you know, we must continually ask the community to stay home when you're sick, avoid large crowds and large gatherings, do that physical or social distancing by staying 6 feet away from each other, decrease the number of places that you go out, wear a mask when you're out in public, and wash your hands. But we need to remember this is a team sport now. You know, this isn't an individual sport, this is a team sport. You know, it's my job to protect you, but it's your job to protect others. We need to make every effort to protect our family, our friends and coworkers that are at risk for a tough struggle if they become infected with COVID-19. These people who are, you know, at higher risk include those who are older and have comorbidities such as heart disease, hypertension, diabetes, and obesity. Also, the number I stated on the hospitals, 316. Our highest number so far is 317. Ladies and gentlemen, our hospitals are filling up with COVID-19 patients. So we want to make sure that, you know, one of the real reasons why this is a team sport right now, that we want to make sure if you or your loved ones need to go in the hospital and have to deal with COVID-19, there's space for you. So we're watching that every day. The hospitals at this point feel like they can handle it. But again, 316, now we were concerned when it got in the 160s and 170s, and now we're at 316 in the hospital. That's high. So please, be careful out there. Now, let's share several of the charts with you. The first one is our Net Health 7-day rolling rate of COVID-19 per county. Here we go, there it is. So again, the cases, basically this shows a 7-day average of new daily positive cases of infection per 100,000 population on a rolling basis. So today I'm here to report we're at 73.10. I can't remember that we've been any higher than that. So again, we have high numbers in the hospital. We have high numbers on our rolling rate per 7 days. We're in the substantial, you know, we said right now in our guidance that 35 is the number, 35 and higher, so we're double that right now. So again, the rolling rate is one of the best ways to closely monitor this trend, whether a trend is unfolding, and again, the trend is definitely unfolding right now. Next slide. To further show you this case, this is the Net Health. Again, we work with 7 counties. So this is our Net Health COVID-19 daily new cases in our 7-county jurisdiction. Again, this represents the day that we received positive test results. Again, look at that graph there. You see that, you know, we were concerned about those peaks back in July, but look where we are now. How those peaks have just grown, and we've really, you know, jumped off the charts there the last few days. Next slide. To take it to Smith County, again, Smith County COVID-19 daily new cases. Again, this represents the day that we received the positive test results. Again, you see that upward trend there. Next slide. This is the East Texas number of COVID-19 positive suspect hospitalized patients. So you see that trend line there. Watch that trend line as it's going up there. Again, our peak has been 317 East Texas and Tyler, Texas hospitals. Yesterday, we were at 316. Next slide. So we remember the whole discussion about if we went over 15% of COVID-19 positive patients in our area hospitals over a 7-day period, we would enact greater restrictions. Well, that happened. Our case rate, we have not been under 15% in our East Texas area G area, which is Smith County, Gregg County, and several counties surrounding us. We have not been under that rate since December the 15th. And yesterday we were at, well, the day before, as of the 10th, we were at 24.33. So again, that number is really going up right now. And again, again, just to repeat that, per Governor Abbott's Executive Order GA32, in areas with high hospitalizations, any business establishment that would otherwise have 75% occupancy or operating limit may operate only at 50%. So, and we don't get out of this restriction until we lower that hospitalization rate under 15% for 7 days or longer. So that's kind of our track right there. So at this point, I know this is the basic information I wanted to share with you all today, but I have some more information I'd like to share, but I know that the real interest right now is on the vaccine. And Dr. McGahey, again, I think I've shared with you all before, he is on he was asked by Texas Department of State Health Services Commissioner, Dr. John Helderstadt, to serve on the Commissioner's Expert Vaccine Panel. So he has up-to-date information on what's going on with that. So we appreciate Dr. McGahey and all the work not only he's doing for us, but also for the people in the state of Texas. Dr. McGahey.
Good morning. Thank you, George, Council, Mayor. Good to see you guys. Happy New Year.
Happy New Year.
We can go on to the next slide. Vaccination update. A lot is happening in the vaccine area. You see it on the news multiple times daily. And I'm going to kind of talk about the status in Smith County and nationally. Here is an individual with the card. If you've been vaccinated, everyone gets that card, and we enter the date you were vaccinated and the lot number and the particular vaccine type you have been vaccinated. In Smith County, we were calculating among all the hospitals in Net Health, I think there have been probably 12,000 vaccinations so far. That's not too bad. We need to do better, though. We need more vaccine, and we need to keep pushing it out. As we speak, at several hospitals, clinics, pharmacies, when they receive it, at Harvey Hall, thank you for allowing us to use that. There's a drive-through clinic going on today, Thursday and Friday at Harvey Hall. So let's go on to the next slide and kind of take a deeper dive into what's happening with the vaccine. Thousands of doses have been administered, both the Pfizer and Moderna vaccine here in the communities, Tyler, Smith County. DSHS is in charge of the allocation of that vaccine. It comes from CDC. Once a week, DSHS gets together and decides where that vaccine should go. This is week 5. We're only in week 5. And every week a little bit more comes out. Healthcare workers, those 65 and older, and individuals with chronic medical conditions are the target now. That's what we call areas 1A and 1B, phase 1A and 1B. Interestingly, the state of Texas, instead of vaccinating, quote, essential workers, opted to vaccinate individuals 65 and older. And if you saw in the news now, the United States is pivoting toward that now, encouraging everyone to be vaccinated who is 65 and older. Texas has already been doing that, so that's a very good thing. We're a bit ahead of the curve. And there's been a lot of information about doses left on the shelf. If you look at some stats, they say only 40% of vaccine allocated is being put in arms in Texas and in the United States. Well, that's not happening in East Texas. The shots are leaving the shelf, flying off the shelf, and they're going in arms. And everybody's using their weekly allocation, and they're at 0 pretty much until the next week. And so I was talking to some folks at the state level and other levels, and they are happy that in East Texas, the doses are being utilized at a very high rate. So that's a good thing. That's a picture of the drive-through clinic on the first day, which is happening now. 2 lanes, they can go up to 3 lanes. That's the driveway in the back of Harvey Hall. I know you're familiar with that. UT Tyler School of Nursing students, UT Tyler College of Pharmacy, Net Health, other facilities are all volunteering to provide that vaccination. So it's a very great process, a lot of good volunteerism going on here. And we, again, appreciate your support. Next slide. We get a lot of questions about the second dose. And again, this is an mRNA vaccine. It's an intramuscular shot. It goes in the arm. And for the Pfizer vaccine, there's a 21-day gap between dose 1 and dose 2. For the Moderna vaccine, there's a 28-day gap between dose 1 and dose 2. And let's go on to the next slide. And we get these questions very often, so I thought I would address them. There's a 4-day grace period between when one receives that first dose and second dose. In other words, for the Pfizer vaccine, you have 21 days. But if you go in 4 days early, day 17 to 18, 19, 20, you can still receive the vaccine. For the Moderna vaccine, if you go in day 20, 26, 27, 28, well, 4 days before 28, I can't do my math this morning, it still is effective. So if you're a little bit early for your second dose, that's fine. Now, What if you're late? There's no really limit on being late. If you come in for the Pfizer vaccine, day 21, day 30, day 60, we'll just still give that second dose. You don't have to restart the vaccination is the point there. So that's a very good thing too. Next slide, please. What are the challenges? There are a lot of challenges, and there are a lot of frustrated people out there, and we understand that. But the vaccine supply just has not met the demand yet. Week by week, we're getting a little bit more, but we still haven't caught up to the need. There are a lot of frustrated groups out there, and we understand that, a lot of frustrated people on waiting lists. When we were at the clinic on Friday and Saturday last week, a lot of people are on 3 or 4 wait lists across the community, and it's a very challenging thing. Registration sites fill up very, very rapidly at Net Health, UT Health Science Center, Christus, and everywhere else. But, you know, I think Mr. Roberts said in 2 hours the wait list was full, or the registration was full, and there are about 6,500 people on that wait list. So that is a great concern. We're working on it. It's a matter of supply and demand. Each week the supply should get better. And we're hoping in coming weeks and months it will be pervasive across the community, and truly everyone who wants it can receive it. We are very pleased that certain groups, especially those 65 and older, are very much wanting the vaccine, and they are very desirous of finding it. And we want to do all we can to help them find it. And many additional groups outside of that, 1A, 1B, the over 65 and those with chronic medical conditions are waiting and needing the vaccine. So we're very cognizant of that, working on that, and as each week goes by, we're hopeful that we can get more. That may be my last slide. Future directions. No, it's not. You're hearing a lot about not holding in reserve that second dose. And the Biden administration has mentioned that. I think President Trump's administration mentioned that. And what they're contemplating is now, if Mr. Roberts gets 1,500 doses, they're holding in reserve 1,500 doses for that second dose. What they're talking about doing is releasing all those held second doses to get more first doses in arms. So it would be basically doubling our supply locally. It would allow, the advantages, it would allow for more people to receive that first dose. And there is protection after the first dose. We really don't know how effective one dose is. We do know that after 2 doses, it's amazingly effective at 94 to 95%. So there's a debate going on. FDA and CDC aren't too, I don't think they support that. I can't say that with certainty. But others are, and there are pros and cons to each process. Now, if all doses are released for first doses, it may make it challenging to find a location for that second dose in 21 to 28 days. So that's a concern there. But whatever happens, we will pivot accordingly. We will work to get as many vaccinations in arms as possible, whether that be the first dose or second dose. And if all the first doses are released, we will work to ensure people get that second dose at the appropriate time. So we'll stay tuned. I think in coming days we'll find out more about that, and if they are going to release all those second doses that are held back. Next slide. Okay, and let me turn it over to Mr. Roberts, and then we'll have time for Q&A, I think. Thank you.
Thank you, Dr. Gary. So let me say a few more points here, and then we'll go to the Q&A. Again, on the vaccine, additional points. Again, we've received, Net Health have received 3,500 doses of the Moderna vaccine since we got our first delivery on December 23rd. We were able to start giving doses of the vaccine on Christmas Eve, gave initial doses, and we moved on our vaccination efforts to Harvey Convention Center on Tuesday, December 29th. And we'll kind of, some of the stuff you already heard, but since this is the first report I've given since we started up, I wanted to make sure I give you this information. So our plan was to vaccinate those individuals in the Tier 1A group, the healthcare workers, first responders, et cetera. On the afternoon of Tuesday, December 29th, Governor Abbott and Department of State Health Services Commissioner Dr. Hellerstedt opened up the program to those 65 and over, as well as those under 65 with comorbidities. This group heard about our effort, and our team ended up giving 588 vaccinations on Wednesday, December 30th. And we finished up our supply of 260 on New Year's Eve. We held our second vaccinations clinics this past week, last Friday and Saturday. Again, we gave over 1,000 doses last week. And today, as Dr. McGahey mentioned, we're going to be giving 1,500 doses today, tomorrow, and Friday at Harvey Hall. We did not do a public press release on that because we were pulling people off the waiting list. He mentioned 6,500 is in excess of that right now. So we have a long waiting list right now. We're trying to get these people in as fast as we possibly can with the doses that we've been given. So again, by the end of Friday, we'll have given 3,500 doses of the vaccine. This has been a Herculean effort by not only my staff, the Department of State Health Services Regional Office, and our volunteers from UT School of Nursing, UT Tyler School of Nursing and Pharmacy, as well as other community volunteers have come in and helped us in this effort. So again, as Dr. McGahey mentioned, we hope that we receive an additional allocation of vaccine very shortly. We're going to be a mass vaccination hub for the state. So we appreciate the partnership with the City of Tyler allowing us the use of Harvey Convention Center. But again, that has allowed us to not only do the drive-through vaccinations, but also to pivot. For example, on Saturday morning when it was cold, it's kind of hard to give vaccinations when it's pretty chilly outside. So we pivoted and moved back inside on Saturday, which was very, very helpful. So that has worked. That site gives us that whole thing there. A couple other items, contact tracing. We continue our efforts with contact tracing. And again, it's important that people understand what action they need to take if they are COVID-19 positive, and also alert their contacts. And we've also worked to help train area businesses, schools, government, et cetera, on how to do their own contact tracing, which was very, very helpful. Testing, local providers have access to testing now. And again, I think Reverend Caraway at St. Louis Baptist Church, there's a free testing site at St. Louis Baptist Church, which is at 4000 Frankston Highway. It's open Monday through Friday from 9 a.m. to 4 p.m. And again, I thank the City of Tyler who allowed us the use of the Tyler Senior Center during the months of November and December. Hospital update. Again, we remain in communication with our local hospitals. We have a dashboard that we receive daily, and we report the number of people that are in the hospital daily to our community as well. We also know how their ventilators going, personal protective equipment, and things like that. So they've stayed in very good communication with us, and our Regional Advisory Council has been able to find extra staff for them to help them flex and take care of people. The schools have continued to work pretty well with us since the 17th of August. That's gone very well. I think really a lot better than we all thought it would. So the schools deserve a real pat on the back for what they've done to really work with our communities to try to keep our schools open and our kids in school. And again, I applaud our community, parents, teachers, school staff, and students for all the preparations as well as their actions to date that have been made to get these kids back to learning. And again, big thank you not only for the City of Tyler, not only for your Harvey Hall and other services you've given us, but also to Mayor Warren, Mr. Broussard, Chief Coble, Chief Toller, Captain Walker, and Ms. Goodgame, who spent countless hours in our Emergency Operations Center meetings, along with added phone calls, texts, and emails. And there have been numerous other city employees in the fire and police departments that have given their time and energy to this effort as well. And finally, a shout out to my staff at Net Health who've worked continuously and tirelessly during this pandemic. They've come to work daily, and they've served our communities very well. So I'm very proud of my staff as well. Again, thank you very much. And again, Dr. McGahey and I are happy to answer your questions.
Any questions for George or Dr.
I do.
McGahey?
I've got a couple.
Yeah.
And it's probably for Dr. McGahey. Dr. McGahey, do we have numbers on how many healthcare workers within our RAC have taken the vaccine?
I think the majority have by now. I don't have a precise number. We can get that for you, but for weeks, we're in week 5, so week 1, 2, 3, 4, and 5, they have been a priority group. And from our institution, what I'm hearing from others, the majority who want it, it's voluntary, have gotten it by now. So we're mostly going into that 1B group, those 65 and older and those with chronic medical conditions.
And then I got a blip on my phone through the news media that it could be 2022 before we hit herd immunity. That's alarming. That's shocking.
Nobody really knows that. I think the more vaccines that go into arms, if we get 60 to 70% of the population immunized, I think we could hit herd immunity. I have not heard 2022. I've heard more summer or fall. No one really knows. But suffice it to say, the more vaccinations that we get in people and the higher that rate, the closer we will get to herd immunity. And if we're not at that exact point, every dose in an arm helps. That's one less person who may have to go to the hospital or transmit it to, potentially, to their loved ones who could get, very seriously ill. Very good.
Mr. Mayor, I want to just commend Dr. McGahey and Mr. Roberts for great work that you're doing in helping to get those vaccines out. The only question that I wanted to find out how many of the school students, you have mentioned that they're doing a great job, but do we have numbers on the school?
Yeah, the
schools?
I'm sorry, the students that have...
The students
Yeah, that's the
and
information.
staff.
Yeah, I don't have that information right at my fingertips right now, but I did do a quick check yesterday. You can get the TEA website, you can go to the TEA website and for under COVID-19, and they actually have listed the number of students and staff that have basically contracted COVID-19 by school district. Actually, they've even broken it down even further by school. Like you can look at Tyler ISD and kind of see what schools have had it. And primarily, the major source of infection has not been school. It's been primarily outside of the school, or in some cases unknown. But most of the time, the vast majority of cases have not contracted COVID-19 at school.
Okay, thank you.
Linda?
Go ahead, Lynn.
I'd just like to commend you also. Being one of the silver-headed people up here, I've had vaccine number 1 and had no appointment, experienced it that way. I think a lot of the confusion now is the appointment process. And I heard Governor Abbott on TV last night saying, I believe he feels that same way. Just show up, stand in line, which is what I did also. And so can you explain how you're going forth with appointments?
Sure,
because
sure.
I have people who call me who are on
Right.
3 or 4 lists. And
Right.
it
So
was so much easier without having to have the appointment.
So what we did, we went to we have a process that's on through our website, and basically now we're pulling off the waiting list. So we opened up the appointments yesterday, the day before, to people on the waiting list, and it's a thing called it's a product called Sign Up Genius. It's the same thing they're using at UT Health Science Center to get their people vaccinated. What we try to do is manage the flow of people through there. For example, I think we're taking care of at least the first couple of hours each day. We're trying to get 45 people through there per hour, and then 65 on the hours after that after we get started. So that totals up to around 500 per day for the next 3 days.
So now the appointment process is in place?
Yes.
Okay.
Yeah.
Well, you did a great job without it.
Yeah, well, it's basically what we found, though, is that people were waiting that first, that day we did 588, it's 3 hours in line. I mean, people were glad to do it, but on a routine basis, it's more orderly. We can, manage the staff better, and it seems to work better. But, how long we do it this way, we'll do it this way until it doesn't work. So we'll basically pivot. We're basically trying this thing as it works, but that appointment system has seemed to work. It worked the last couple of days, so we'll see how it works this week.
Well, great job, guys. Thank you for all the work.
Thank you. Yes, sir.
George and Dr. McGahey, I just want to commend y'all for y'all's work and what y'all are doing. A couple of questions. At Harvey Hall, you've got it set up where after you get your shot, you go to a holding pattern to
Correct.
see if any side effects. Have you had anybody experience side effects? I've had multiple friends that have had the shot, and only one person really had any side effects. Most have said just a sore arm the next day.
Yeah, that's been the major side effect. But with the vaccine, one of the things, the directives that they gave us, and I'll let Dr. McGahey speak further to it, but said they found in the trials that basically you want to watch people for 15 minutes. And we've had a couple of issues with people. We've had to call EMS a couple of times. But Dr. McGahey saw people the other day, and they did not get transferred to the hospital, but he was able to talk to people through it. And he might respond a little bit better.
Our experience has been good, and I think across the system as a whole among those 12,000. We've had a couple of people who felt a little faint, as they would with a tetanus shot or a flu shot or something like that. And we just monitored them very closely. We did not have to administer any medications or transfer anybody to the hospital. Now, across the country, you've heard about those anaphylactic reactions, those very severe allergies. Well, that's happened in about 11 people per 1 million population. There have been no fatalities. That's a very, very rare event. We have not experienced that here, and we have administered several thousand doses. So it's been soreness in the arm. Usually the side effects can be somewhat more intensified after that second dose, but that's normal. That's just the body's immune system reacting. Might be a little fever, might be more soreness in the arm. But all in all, it's been very, very positive.
And then I can see when you'll start the second dose that that's going to be a real effort. You've got people still lining up for the first dose. Now you've got to figure out the second dose. Do you do it at a different location so there's no confusion? That's going to be quite an effort.
It will, but I think we have a computerized system called M-Track. We have the cards that can help. You know, we want people to hang on to that little card, so in case they go to another venue, we'll know what dose they got initially, whether it's Moderna or Pfizer. Plus, we have that M-Track system to look them up in the computer. Plus, the other added complication, not complication, but the possibility is we could be opening up in more areas. I know the new administration wants to provide some resources to work in school gyms and other places, so there might be other opportunities to mass vaccinate. So a lot of spinning plates all at once. You are correct. We'll have to be sure to sort that all out, and I'm sure we'll be able to do that. Thank you.
Yeah, I do have one more, and mine's more of a comment in support of the statement that you made, George. Is I read recently that 67% of retail and restaurants in the state of Texas are in threat of being closed because of this pandemic and the lack of business. And so it's maddening to me that I still see so many in the community that are not following the COVID protocols laid out by the CDC with the wearing of the mask, cover your cough, stay home if you're sick, and wash your hands frequently. And then socially distance when you're out and about. So I just want to re-support your statement and say, please do that. If you love your community, if you love the place that you shop, if you love the place that you dine out and enjoy your family time, if you love your neighbor, follow COVID protocols, wear your mask.
Absolutely. I think that's, you mentioned that, Bob, and, Mayor Warren mentioned last time about the person who sat behind the church that passed away. So, I think we're all seeing people right now. I saw in my own text stream yesterday, my own family, that, my family members are getting other Tennessee and also in San Antonio have just contracted COVID. So, it's hitting everybody now, and you're also seeing people on Facebook and social media with their family members are really sick in the hospital. So it's personalized now. So be careful out there. We need everybody to really watch this right now. Pay attention. Thank you.
Well, thank you both.
Thank you.
I will say that the Wednesday where the governor changed it from 1A to also 1B, the day you got bombarded. And I think that's the day where people had so many comments on Nextdoor and all that kind of stuff, and it was just kind of a fiasco. Well, as I told you, some of my family members that went that following Friday and Saturday, they went through the drive-through process at Harvey Hall where you pre-registered, and it was flawless. And everyone that went through there that I know said it took them like an hour and 15 minutes to go through the whole process, and it was just perfect. So practice makes perfect. So
we'll get better at it too. And I think that will we ever have a time when we basically do walk-up councilman's? My guess is probably yes, a little bit further down the line. But right now the demand is just, but I don't want people, lines, like we saw that first day, and could create, spreader events too. So this seems to have worked. So
I thought it was wonderful the first day.
Yeah.
Last question. How far away from your second immunization should you register on M-Track?
We don't register through M-Track. I'll let you.
Well, I think it's the sign-up genius, and that's going to be challenging. I think it would be 28 days after the Moderna vaccine, and George will periodically open that up before those second doses. So I think we'll be keeping people posted on that.
But no registration.
Well, I think, George, and we will be registering for that second dose. I think we need to sort through that. If we'll be calling people or registering for that second dose.
We'll be registering people. We will register people for that second dose. Again, I don't want to like I did this week. I don't want to put it out there to people that I registered you for a time and I have no vaccine either. So, so I want to make sure that I have vaccine in hand before I allow you to register for
Well, I know you have 3,500 people out there now who are going to be very anxious about that, so.
Well, it's not 3,500. I've already, by the end of the week, I will have given 3,500. Oh, you said 35 for the second dose. Yeah. Oh, yeah, I get questions about that all the time. So, yeah, probably I'd say another week or so we'll be putting something out about registering for a second dose. But again, I don't want to have people register for the second dose and not have them
Right.
in mind.
You just saved me a bunch of text messages, so
Okay,
Thank you all very much.
Thank you. Don't take off. We have one guy with a card. So Bob Brewer, do you want to come speak to this item? Cassandra? Bob's a great guy, but we may need to put the timer on him for 3 minutes.
I was going to send you the Gideon instructions for East Texas on their experience for yesterday. So it is a little bit complicated, but doable, and it takes about an hour. So anyway, my questions are, how many tests were administered per new case reported on each reporting period? What are the per capita deaths what per capita deaths do we have this year versus 2018 and 2019? So that's for last year, 2020. Same question for the flu. Where have masks shown to be effective? Are mask laws written in accordance with Article 1, Section 1, and our Republican guarantee in Article 4, Section 4? How many people do you know who've been arrested for not wearing a mask? Do mask laws comply with the second sentence of U.S. law? And that's the God-given unalienable rights to protect our lives the way we feel they need to be protected. Are masks harmful to unhealthy people? What percentage of people wear a mask correctly? As an atmospheric chemist, I've worked in atmospheres that were deadly if you had a leaking mask. And when I walk around and I see people with masks with holes in the side and shooting up the top and out their nose or off their face, you know, it just seems like, you know, an impossible task. Also, what size is a coronavirus versus an influenza virus? I'm pretty sure that the influenza is considerably larger than a coronavirus. So why are we trying to catch the little guys before we catch the big ones with a death rate that's comparable to COVID? So anyway, on the vaccines, have pharma liability exemptions been removed for these new vaccines? In referencing the Great Barrington Declaration, have more people died as a result of lockdowns as to COVID, the J. Bhattacharya and the Oxford doctors and all that, and also our Scott Atlas? I think in June we passed that number. Lockdowns surpassed COVID deaths like in June. Why don't we utilize the SARS-1 vaccine, which is 78% similar to the one we have now, that was recommended by Dr. Fauci in 2005. And who decides the protocols for COVID treatment in our local hospitals? And who developed that protocol? And who funded that protocol? So I think there's a lot of questions that need to be answered, and I know I've asked about how many tests have been administered more than a half dozen times, and I haven't gotten an answer.
Bob, I got to ask you, why at Commissioner's Court you never go over the 3 minutes?
Did I go over here?
Just a tad.
Well, you know, they started the timer when I tried to give them that picture yesterday.
Well,
You know, I'm trying to give them
okay, appreciate you. Okay, thank you, guys. All right, now we're going to move to zoning, Z1, Kyle.
Good morning, Mayor and Council.
Morning.
This first request is a request for a annexation of approximately 5.84 acres of land. This is located along County Road 219, just east of Haverhill Drive. You can see here on the map. This is a voluntary annexation request on petition of the property owner. The property is contiguous to the city of Tyler on its western and southern boundaries. It's, the properties to the west are developed with townhomes, single-family townhomes, and then to the south and southwest are apartment complexes. The applicant intends to develop the property with residential uses similar to the townhomes to the west, and they are requesting original zoning of NR, Neighborhood Residential District. This annexation ordinance would adopt the new boundary of the city limits, which would encompass this property. The new boundary of City Council District Number 4. It would authorize the city manager to sign a written agreement for provision of city services per the Texas Local Government Code. It would adopt the future land use guide to reflect single-family residential medium high density, which would be consistent with the existing development in that area. And then finally, it would adopt original zoning of 5.84 acres of NR Neighborhood Residential District. Of the notices that were sent to the neighbors, one was returned in favor of the request, actually from the property owner outside the city. And then we didn't receive any in opposition to the annexation. And with that, the Planning and Zoning Commission by a 4-0 vote recommends approval.
Any questions for Kyle?
Move to approve Z1.
Second.
Motion by Wynn, second by Sellers. Any further discussion? All those in favor say aye. Aye. Opposed? Motion carries. Z2.
This is a request to close a unimproved thoroughfare or right-of-way. This right-of-way is located in Council District Number 2. The applicant's requesting to close this unimproved right-of-way to incorporate it into their adjacent properties. They own both properties to the west and to the east. And so after finalization, they will have to replat the properties into one lot or two lots. The Planning and Zoning Commission by a 6-0 vote recommended approval of the closure of the right-of-way, subject to it being replatted within 6 months.
Any questions for Kyle? Motion by McGee, second by Curtis. Any further discussion? All those in favor say aye. Aye. Opposed? Motion carries. Z3.
This is a zone change request from R1A Single Family Residential District to R1B Single Family Residential. The applicant's requesting the zone change to allow for the development of single family homes. This property is located along Callaway Road and is in District Number 5. The properties to the north are currently zoned for commercial and residential uses and are developed with commercial and a single family home. The properties to the east are zoned R1A, single family residential, and are currently undeveloped. To the west is currently zoned for commercial use, and then to the south is the location of storage units and is zoned for industrial use. This request would amend the future land use guide from mixed use center to single family medium low density. The applicant plans to develop 4 single family homes on this property. They plan to subdivide these properties into 4 lots. With the exception of the property to the west, the properties along Callaway Road on the north side are generally developed or zoned for single family use. Of the 6 notices that were sent to the neighbors within 200 feet, 0 were returned in favor or in opposition to the request. The Planning and Zoning by a 6-0 vote recommends approval of the zone change.
Any questions for Kyle?
No, I just want to make a comment. I'm excited to see development happen along that street and hope it encourages the other landowners to do the same. With that, I move to approve Z3.
Motion by Westbrook, second by McGee. Any further discussion? All those in favor say aye. Aye. Opposed?
Doesn't matter. Nay.
Have you filled out a card, ma'am?
Get a card.
Let's just pause for a second. you. Shirley Logan? Can you state your address, give us your address for the record? Your address?
2321 Log Lake Trail, Denton, Texas.
Okay. And I understand you own this property?
Yes.
Okay. You want to speak on this item?
I own this property that you're talking about.
Okay, so I assume you're for what we're considering doing, correct? You want this to pass, correct?
No, I don't want it to pass. I have questions about why it should pass. This is a neighborhood community. It's called the Clayton community. And we have our own family church and everything there. And the family that, I don't live there, but we come there all the time. This is my home. I was born there. And all the members come for their memories and everything. And I'd rather keep it 1A single family because I don't want to change it. Right now I'm getting processed. I have to get processed with the lawyer that this customer is talking about. Because the land that they're talking about, some of it is supposed to be still be mine. So my husband had been sick. He was on the hospice, and they've been to my house, and they know that my husband's been sick, and now since then he's died of Alzheimer's. And then with the COVID, I didn't have a chance to talk to my lawyer, and I want to talk to my lawyer before anything is approved. The other people that lives in the community, they can't speak because they don't own the property. But I'm glad that I'm able to speak up for them because if it's not broke, why do you want to fix it? And I'm here to be against this. I want to keep it the 1A single family right now until I get everything straightened out. And then I can decide, about this other.
Okay, thank you for being here. I'd like to get Kyle back up here, but I'm not sure who filed this application for this zone change, but the zone change from R1A to R1B, it's a tiny change. I mean, you're talking about your side setbacks.
I don't want to change it all right now until I get this land straightened out.
Okay, I need to ask Kyle who it is that actually applied for this application, because maybe there's a different property owner that maybe applied for this. Ms. Logan?
Ms. Logan, do you mind if Kyle comes up there?
I need the envelope, they had the name at the bottom.
Okay, Kyle, who filed the application for Z3?
Yeah, it would have been the Jose Castellanos. Only the property owner can apply for the zone change.
With
So
Ashley Downing. Is Ashley Downing your cousin that you made mention of?
No, nobody my cousin.
No, nobody named Ashley Edward Downing?
No. Nobody.
Because they also are shown up
I don't
to
even
own
know.
that property as well.
Who?
Ashley Downing or Edward Downing?
No.
this is for, I guess I don't have the address here, but
2704 and 2706 Callaway Road. Is that the address you're looking for, Kyle?
yes.
Okay.
Is that your address? Do you own that property?
That whole section is my address. Yeah, 10 acres.
She's shown as on the notification list as the property owner
Yeah.
for 999, but so is Ashley Downing.
Yeah, they put that there, and I don't know why they
And
did
Edward
that.
Downing. Now, you also own property that appears a bit
Right.
over here, correct? Okay.
On all of it.
Mayor, would y'all prefer to table this item?
Yes.
What, 2 minutes?
Maybe we should table this till we figure out what's going on. Somebody wants to make that motion.
I move that we table Z3.
I second.
How long you want to table it, Linda?
We table it to the next.
What is your
meeting.
recommendation, Kyle?
Well, to the next meeting.
To the next meeting.
To the next
To the
meeting?
next meeting.
30 days?
Okay, you want to do 30? To the
Okay,
next-
we have a motion by Sellers, a second by,
I'm not giving my lawyer, you know, I'm in the business.
Yes, ma'am. The next meeting would be on January 27th.
What day is that?
That's a Wednesday. We do it on the second, fourth Wednesday.
thank you. Thank you, Ms. Logan.
But this is January now, so.
Yeah, so it would be in January. I mean, and if for whatever reason we brought it back, if it wasn't ready on the January 27th, we would notify council that there are still discussions. Because it showed, the tax records show that there's another property owner that also owns that as well. And we need to find out from the
Right.
applicant
I
what,
need to get this straightened
who
out.
the applicant works for, because that's the one who's allowed to make the rezoning request.
Thank you.
You're welcome.
Point of order, Mr. Mayor. We've got a motion and a second on to approve. So I need to withdraw that motion. Is that correct, Counselor? Yes. Okay, I withdraw my motion to approve Z3.
So we've got a motion by Sellers and a second by McKellar to table it for 30 days, or up to 30 days. Was that correct?
That's correct.
Well, yeah, but I told her it was January 27th, but if y'all want to do 30 days until the first meeting in February, that's fine too.
Up
Just
to
need a
30
date.
days.
What was that, sir?
Up to 30 days?
Up to 30 days? That's,
I
However,
amend the motion to up to 30 days.
okay, we got a motion and a second. Any further discussion? All those in favor say aye.
Aye.
Opposed? Motion carries to table it for 30, up to 30 days. Z4.
This is a zone change request from AR Adaptive Reuse District to DBAC, which is Downtown Business Arts and Culture District. The applicant's requesting the zone change to allow for a mixture of office and residential uses on the property. The property to the north is currently developed with an office. The property to the south is Zone C2 and is for commercial use. To the west is for multifamily and commercial uses, and then to the east is zoned DBAC, and M1 light industrial is currently developed with commercial uses. The request is consistent with the future land use guide, which identifies the property as high-density mixed use. The applicant does have, there's a building on the property which has been used as an office, but there's also, I believe, garage apartments that they want to renovate and allow for residential use. And so the downtown district, or the DBAC district, allows for that mixture of uses on one property. And since this property is located within the downtown planning area, which is identified in the Tyler First plan, the DBAC district is allowed to be used or within this area. And so of the 13 notices that were sent, 0 were returned in favor. We received 1 in opposition from the property owner to the north, with a total protest calculation of 14.82%. They were concerned with the use of the property for non-residential uses. The Planning and Zoning Commission, by a 6-0 vote, recommended approval.
Thank you, Kyle. Any questions for Kyle?
Second.
Got a motion by McGee, second by Curtis. Any further discussion? All those in favor say aye. Aye. Opposed? Motion carries. D5.
This is a zone change request from C1 Light Commercial District to R1B Single Family Residential District. This is in Council District number 2. The applicant is requesting the zone change to allow for the development of a single-family home. Generally, the properties to the northeast and south are developed with single-family homes. The properties to the west are a mixture of single-family homes and commercial uses. The request is consistent with the future land use guide, which identifies the property as single-family, medium, low density. The applicant plans to develop a single-family home. This request is consistent with the Tyler First goal of adding 3,000 more households to the north end. Of the 22 notices that were sent, 0 were returned in favor or in opposition to the request. The Planning and Zoning Commission by a 6-0 vote recommended approval.
Any questions for Kyle?
Move to approve C5.
Second.
Who was the second from?
Me.
Got a motion by McKellar, second by Westbrook. Any further discussion? All those in favor say aye.
Aye.
Opposed? Motion carries. C6.
This is a request for a planned multifamily district site plan amendment. This is to allow for the addition of 4 two-story duplexes to the existing duplex development. This is along Roy Road, just west of Rome's Quarter. The properties to the northwest and south are zone PMF planned multifamily and are part of this development, and they are being developed with duplexes. The properties to the south are currently undeveloped. And to the east is the location of commercial uses, the landscaping business, Petty's Landscaping. This request is consistent with the future land use guide which identifies as a townhouse garden apartment. The applicant plans to add 4 duplexes, increasing the density from 6.26 units per acre to 6.9 units per acre. The proposed units will be abutting the commercial development to the east and will be located away from the adjacent lower density residential uses to the west and south. The existing buildings that are currently built are 1 story, ranging from 1,200 to 1,500 square feet in area. The proposed duplexes are 2 story with approximately 1,300 to 1,400 square feet in area. All other criteria, including the setback, signage, landscape, and fencing that was approved with the original site plan for the development, are still intact. Of the 4 notices that were sent, 0 were returned in favor or in opposition to the request, and the Planning and Zoning Commission by a 6-0 vote recommended approval.
Any questions for Kyle?
I do. Kyle, since the remaining properties in that subdivision have not been developed further south, knowing that there's just one exit into that property, if the owner comes back and wants to rezone the others for higher density also too, is that adequate?
Right. Yeah, the access point, that would be evaluated if that did happen, if they wanted to do a similar change to the south. We would evaluate the required access points for the number of lots. With it being less than 60 lots, then there's only 1 access point required.
Okay.
If they plan to further increase the density and further subdivide the remaining lots there, then that may trigger the need for another access point or limit the density at that point.
Great, thank you for the clarification. With that, I move to approve Z6.
Got a motion by Westbrook, second by McGee. Any further discussion? All those in favor say aye. Aye. Opposed? Motion carries. All right, R1.
Good morning, Mayor and Council.
Morning.
This first item is a request that the City Council consider adoption of a resolution approving a public improvement district policy which sets forth criteria for determining establishment of a PID and which outlines petition requirements. On the line, on our virtual world here, we do have our bond counsel, Mr. Bob Dransfeld, as well as Jordan Sawyer. We also have a PID administrator, Mary Petty. The Public Improvement District, which is an economic development tool that permits the financing of qualified public improvement projects that the city determines confer a special benefit on a geographically defined area within the corporate limits of the city as well as our extraterritorial jurisdiction, or ETJ. The proceeds from bonds issued by PID can finance public improvements to meet community needs which would not otherwise be constructed or provided. The bonds issued pursuant the PID Act to fund the cost of eligible public improvements are paid entirely by property owners within the district or the PID who receive special benefits from the public improvement projects. As you can see here on this slide, the PID must be self-sufficient and not require the city to incur any costs associated with the formation of the PID, the bond issuance costs, PID administration, or the construction of PID improvements. And also, we evaluated our PID policy to include that PIDs, proposed PIDs, must generally be located within or adjacent to the North End Revitalization Planning Area as identified in the Tyler First Comprehensive Plan, as you can see here on the screen. The purpose of the PID policy is to outline the issues to be addressed by the owner of the taxable real property liable for assessment petitioning for creation of a PID before council can consider the establishment of a PID. The PID policy is intended to aid the City Council to determining whether the creation of the PID is financially feasible, practical, and in the best interest of the city. The PID policy also outlines petition requirements, qualified cost, financing criteria, information disclosures to property owners, and the determination of annual plans, budgets, and assessments. And with that, the staff is recommending that the City Council adopt a resolution approving a public improvement policy which sets forth the criteria for determining establishment of a PID and which outlines petition requirements. We do, again, have our bond counsel and our PID administrator online, so if you have any further questions, they're available.
I don't have any questions. I just want to make a comment. To me, this is the perfect project for the West Loop. You know, this PID tool is exactly that. It's a tool to help start a development that's sat there for a long time, not being developed. It's gonna pull people that are customarily going south Tyler, hopefully to West Tyler, and hopefully ignite a new start in a new area. Now, one thing that I want folks to realize is that this does not take away any tax revenue from the city. I mean, the bonds, they're not on the city's balance sheet. The risk to the city is, if any, is minimal, but the impact is huge. So personally, I'm excited about the project, and if y'all want to interject, feel free to.
Well, I am too, and the applicant that we'll discuss here in a minute, these things don't just happen because they've been approved. There's extensive market studies as to what can come into the area and so on too, that helps guide the developer whenever a PID is created. So I think that it is that very thing, Mr. Mayor. It's a tool to develop targeted or underdeveloped areas of the city.
We got one card here from Stuart Fink. Stuart, you want to come speak, or just have questions?
I was just here to answer any questions.
Does anybody have any questions for Stuart?
Mr. Mayor, I want to say as well that I am happy to hear that Tyler is growing to that level. That was one of the first questions that I asked when I came on council is, do we do PIDs here in Tyler? So I'm glad to hear it. So I look forward to it going even closer to the north side of the city. Thank you.
I'm excited as well, so I want to make a motion to approve all of them.
Second.
Motion by McGee, second by McKellar. Any further discussion?
I'd just like to state that this is a beginning process for those people that are watching this live today. This is not the final decision on this. It is the beginning process, and now there'll be public meetings. I think it's important for the people who are watching to understand that. And I'm very much for it also. I think it would be a great opportunity for Tyler.
And I think that's, the whole PID policy in the next item is actually, I mean, this is really just to start the discussions. You're right, so, good point. So, we got a motion and a second? Correct? All those in favor say aye. Aye. Opposed? Motion carries.
All right, our next item is a request that the City Council consider adoption of a resolution adopting a petition from Bellwood 323 2019 LP to create a public improvement district, a PID, and consider establishing a public hearing date regarding the creation of the district. And that goes back to what Councilwoman Sellers was saying, that there is a process, and I'll go over a little bit of that in a moment. On January 13th, today, Bellwood 323 submitted and filed with the city clerk a petition requesting the establishment of West Side Place Public Improvement District consisting of approximately 538 acres of land within the corporate limits of the city of Tyler. The PID petition meets the criteria of the PID policy, which was just adopted. And the City Council establishes a PID by adoption of resolution after a public hearing. Written notification of the public hearing is published and mailed to all property owners within the proposed PID, which in this case is one property owner, Bellwood. By petition, the owners pledge to pay an assessment in order to receive enhanced services and/or improvements within the district. The PID must demonstrate that it confers a benefit not only to the properties within the district, but also to the public, which includes the city. And with that, it is recommended that the City Council adopt the resolution accepting the petition from Bellwood 323 to create a public improvement district and considering establishing a February 10th, 2021 public hearing date regarding the creation of the district.
Any questions of Heather?
Second.
I've got one card. I've got a card here from Terry Bonner. But Terry, I gotta tell you that if you're gonna speak, you gotta speak to the item that's on the agenda.
Oh, I have.
Okay, because I,
17 South Chapter, I don't know why that.
okay, now if you get off topic, we gotta stop you. Can you say your name and address for the record, please?
My name is Terry Bonner. My address is 1110 South Academy, also 3101. I have several properties in Tyler. R2, is this 3 or 5? And I would like to have that admonition or admonishment marked as I walked up here. Is this 3 or 5 minutes?
3.
3, okay. All right. Public improvement districts, let me be real careful here, are great things. Also, I'd like to notate that, you know, I do feel like there is a strong urge for the city of Tyler to hush its citizens, okay? And this will be it, by making people have to pick these items on here. I'm gonna be real quick with you. 227. But how is improving the public or public improvement districts helping black citizens of this town when, I am not going to mix words with you, Tyler is an extremely racist and biased town. It's time someone said it and does something about it. It's written all over the wall. You go to Confederate, Robert E. Lee.
We got to stick to that agenda
I'm
item, sir.
sticking to it, sir. I'm still sticking to public improvement districts and why there's a need for them when there's racism running rampant in this town. Now, public improvement districts are great, and I'm going to, let me see here, are great, but when you have a juvenile justice system ravaging our youth to the predatory lending that you allow in this town that affects black people, how are you going to improve a district? Yeah, I know. Putting up houses for who in the north? Who can buy them? Can black people buy them? With the 6.5% college readiness rate of black graduates around, and let me put that in perspective for you. For every 400 black graduates, only 26 of them are ready for college in Tyler. Do you understand what kind of gap that creates within the black community and what kind of gatekeepers that allows to happen in the black community? Okay? Now I'm trying to stick to your topic for you. But when you let Trump supporters run rampant without masks in a town, doing God knows what to black people, when you got the Grand Slam getting all these black dollars and assaulting Christian Tyler at their facility, let me be real quick because I got 15 seconds. This is what I came to say. Tyler won't flourish until his black residents flourish. You think True Lamb was something? We're going to put Tyler on a national stage, and we will stop any business from coming into Tyler because we will let the world know about the racial tensions right here in Tyler, Texas. Thank you very much. Y'all have a good day. Y'all stick to your topic.
Thank you, Mr. Bonner.
You are not wrong.
Where were we?
You had a motion and a second.
Do we have a motion and a second?
We do.
Okay. All those in favor say aye.
Aye.
Opposed? R2 carries.
I'm sorry. We got a motion from McGee. I'm sorry, we didn't hear the second. I'm sorry.
And second.
I second. Thank you so much.
All right. Mr. Fink, good luck with your project. We look forward to working with you. Thank you. Thank you for being here. All right, M1.
Good morning, Mayor.
Good morning.
My name is Dustin Wilson. I'm the CDBG manager for the city. And this is a request that the City Council consider approving a minor amendment to the 2020 to 2024 Consolidated Plan and the Program Year 2020 Annual Action Plan. As the council is aware, each year the city gets funding from the city or from the federal government in the Community Development Block Grant and the Home Grants. And each year we have to file an annual action plan telling HUD how we're going to use those funds. In February of 2020, HUD told, if we could go to the next slide, please. HUD told the city that we would be receiving $874,332 in CDBG funds and $366,470 in home funds. In October, HUD informed us that they made a miscalculation in determining their amounts, and the corrected amount is $874,199 in CDBG funds and $366,401 in home funds. And you can see the difference there. It totals just slightly over $200. And so this is really just an amendment to our action plan and our consolidated plan, telling HUD that we're only going to spend up to the corrected amount. It's not going to affect any projects or delay any projects. And with that, staff does recommend that the council approve the minor amendment.
So this is making a modification of $202?
Yes, sir.
Move to approve.
Second.
Motion by Wynn, second time by Sellers. Any further discussion? All those in favor say aye. Aye. Opposed? Motion carries. M2.
Good morning.
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 I am so excited to be here this morning to present this special project to you all. The Neighborhood Services Building located on Gentry Parkway and Palace Street is up for remodel. This building was built in the early 70s and was actually the first African-American owned and operated bank in Tyler. Yes. And the city of Tyler actually bought it after many years of being vacant in 2008. And upon purchasing the building, it was really for the intent to bring back some vitalization to the North End area, as well as to put a vital service right at the cornerstone or the crown jewel of the North Tyler area, which is Gentry Parkway. We have recently built a fire station just catty corner to this property. We are in the process of building a brand new subdivision right behind this property. And what happened in 2008 is that after we invested in the purchase of the property, we were only able to do minor remodel to it. So it still has the facade of a 70s building. It still looks like a bank. We even have the drive-through, little drive-through at the back that we use sometimes for the food shop, but we won't be doing that anymore. So at any rate, what we have been able to do is secure a grant through the federal government, and it was actually through COVID that we were able to secure this grant so that we could set up protections inside the building for the staff as well as for people coming to visit. And so since we were able to get that grant, we've asked Fitzpatrick to give us a drawing and come up with some phases of what we actually can do with it. So I have Brian Phillips here from Fitzpatrick that's going to run through a rendition of it and ask you all to actually approve the expenditure of this grant for the remodel of this building. And if you have any questions, I'd be happy to come back up and talk to you about it. Brian?
Thank you.
Good morning, Mr. Mayor, City Council.
Good
Morning, Brian.
Brian.
It's been a pleasure to work with Ms. Wade and Mr. Butler and Ms. Crossman on the project. We have two phases. We have an interior phase and exterior phase. What we're going to talk about today is the interior portion. It's approximately 6,846 square feet. If we'll go to the first slide, I'll show you all the floor plan. On the northeast corner of this plan is the former lobby area, and what we're doing is creating a space that will promote health, safety, security, and welfare of both the staff and the public that they serve. We're taking a former reception area, making it into a public training space. We're also creating a reception area that has a direct line of sight to the entry vestibule. We're also doing some other improvements throughout the building. We're separating the staff restrooms and creating a new public restroom. We're updating the city staff conference room and doing some other improvements throughout the building. The total is $323,083. It'll take 135 days or 4.5 months to complete. Our phase two, I'm going to go through a couple slides of our 3D model. This is the entry area. That what you see right there is the reception area, and then we have kind of cubbies for staff and public to interact. Currently, when the public comes in, they're brought back into the staff areas, into staff offices, and so we're creating a new space where they can be greeted and serviced up in the front of the building. There's a plexiglass divided between the public and the staff in these customer care areas. We can go to the next slide. The next slide is kind of another view of that. So two people could be there at a desk and interact with a staff member without having to go back into the staff's office. Let's see the next slide. This was formerly the reception area that didn't have a line of sight to the vestibule. We're turning that into a training or a conference room for public use that's directly off that public space. Let's go to the next one. And then this is the staff conference room that would be used for staff meetings and city functions. And we can go to the next slide. This is the site plan. This is actually, I'm going to go through some of the work that we're going to be doing in phase two. Both projects have bid. They both came in within our anticipated budget, and both would be completed by the same contractor. One of our goals for this phase was to better define entry, to address damaged and deteriorating exterior, to create an outdoor space for the staff under the covered drive-through, the former covered drive-through, and then to secure the staff parking. So as you see the site plan, we've got, we're doing some improvements to the ADA parking spaces to provide accessibility to the front entry. The front entry is on that northwest corner. We have a public plaza up in that corner. And then kind of toward the south of the plan, that's the covered drive-through that's going to become a covered patio for staff. And then that south portion is the enclosed and gated, secure staff parking area.
Brian, can you talk into the microphone?
Oh, sure, I'm sorry.
No, or just move it to where it kind of better follows your voice.
Okay. Let's go back to that previous slide. And these are, again, are some snapshots, maybe one more. I'm sorry, that exterior view. That exterior view? Okay. And I'm sorry if I'm talking too fast, and I'll try to talk into the mic. This is a view of that entry point. This is the new entry. We're going to go through and recover the existing facade. We're going to create kind of this new entry form in that entry plaza.
But that would be a separate project, right?
That's a separate project. That's phase 2. And then we'll just go through a couple of these. These are just different views of that exterior that we're going to be renovating. That's the public plaza area. That's a view to the new entry vestibule, and then from the entry vestibule, you'll go into the public space. Like I said, this is phase 2. We'll be addressing that in the next city council meeting. Both were bid and we're within our anticipated budget. We're excited to be a part of the project, and thank y'all for the opportunity.
Any questions or comments for Brian?
Will staff have to be displaced during the project?
No, we worked through, we're going to be phasing some of those portions. So as we're working through the entry vestibule, we're going to be doing that. We'll retain the rear entry, and then we'll be working our way through the building.
I do have a question for Renessa.
Okay.
Renessa, forgive me if I missed it. Was this project going to be 100% funded by the grant, or is there a match?
No.
And even
No
phase?
match.
On phase 1.
Yes,
phase 1.
grant, all funded, yes.
Perfect, thank you very much.
On phase
So,
1.
Ms. Wade, I'm sorry. Okay, I would just like to say that I want to commend Ms. Wade and the city manager and the mayor and council, because I've never been more proud when I was a young college student to walk into that building with my parents to open up an account in a Black-owned bank. So I thank you for continuing to have that bank building standing still, and that the city will be able to take it over and move forward with this grant. Thank you for that. With that being said, I'd like to offer a motion to approve.
Got a motion by McKellar, second by McGee. Any further discussion?
Don, I got a question. So what about phase 2?
So phase 2 is currently out to bid, or did y'all already get the bids in?
Yeah, we bid last week.
Okay.
And, oh, sorry.
That's horrible.
We bid last week. It was, came in at $427,800. That was within, the combined total of both of those was within our anticipated budget. The total would be $750,833, with a total of 7.5 months for renovation. Garrett Associates is the contractor.
So, but that one, so phase 1 that you have before you is 100% funded through the COVID relief funds that we received. Phase 2 will be, I think we'll be using some of the COVID reimbursement towards, as well as some of the I guess the COVID funds that we received specifically related to CBG and home. Is that correct as well? Yes. So, but I just wanted to make sure that because we're showing pictures of both, and so make that delineation of, this is the interior project, 100% funded through COVID funds. The exterior project we brought back to you in a month or two or so, and that one will be a combined funding streams from different money we've received related to COVID.
Okay, we've got a motion and a second. All those in favor say aye.
Aye.
Opposed? Motion carries. M3, Lisa?
Good morning, Mayor and staff. This is a request for a construction contract with Solid Bridge Construction LLC for the construction of a storm sewer repair project at 3521 South Broadway. The property in question is located just south of Amherst, and this is where the old Shogun's restaurant used to be. So currently there is a 48-inch storm sewer pipe that runs from Broadway sort of diagonally through the property and then discharges into an existing natural creek at the southwest corner of the property. In addition, there's a 24-inch pipe that runs from the north, and then that connects directly into that 48-inch pipe. The 48-inch pipe had some joint failures, which caused some sinkholes in the parking lot of this property, in and around the trash enclosure, and in fact, eventually caused the trash enclosure to just completely collapse. There's been quite a bit of erosion at the discharge point in the creek, which caused several joints of the pipe to break off into the creek. So the whole property has been a mess. So the city hired an engineer to produce construction plans. The plans were put out for bid. We did receive 5 bids, the low bidder again being Solid Bridge Construction at a price of $186,830. And staff does recommend authorization of this construction contract.
Any questions for Lisa?
I do have one. I know, Lisa, that we've got an approved list of contractors that we allow to bid our projects. This contractor obviously is on that list.
They have done work in the past. In fact, this is the contractor that did the Ashmore drainage project. They are a really good contractor, and they are on our approved list.
Great, thank you.
I entertain a motion.
Move to approve.
Second.
Motion by Sellers, second by Westbrook. Any further discussion? All those in favor say aye. Aye. Opposed? Motion carries.
Thank you.
Mr. Dixon.
Good morning. So let's get started.
Take it off.
Please do it. Yeah. Yes, good morning. This is a request for a change order for an instrument landing system project there at the airport. Kind of a little background on the project. This is a project where initially for many years we had instrument landing system on our shorter runway. And an instrument landing system, or an ILS, is really all the lighting and navigational systems that assist aircraft in coming in inclement weather conditions. Really lowers our approach minimums. And after that runway project that we completed, it was a program with the FAA that we moved forward with relocating our instrument landing system to that long runway. So this is that program now, and the equipment that is involved in being placed will eventually be, once accepted, will be under the ownership of FAA and be maintained by FAA. And throughout the construction, they've had a lot of involvement as far as the inspection of the program, and also making some other recommendations and added some things, and that's the result of this change order. Just to start off, this $183,000 change order is 90% eligible for refund through our federal grant program, AIP, Airport Improvement Program, with the local share being about $18,386. The prime reasons, I think, for the change order, one was to reconcile as constructed quantities that are already done, but also during the pandemic, as I mentioned, FAA was there to inspect the project, and they had to pull off of the project for quite some time, which stopped it. And so we couldn't, or our contractors couldn't do any work without FAA representation there. So it meant our contractor having to remobilize a couple of times throughout the program, which is a cost that's shown here. You'll see too, there's some more smaller items as far as electrical changes that I think FAA want. It's very, very technical in nature, this type of program. And also too, there are service roads that go to these different facilities that are being installed. The system itself stretches from one end of the airport to the other. And you've seen them, I'm sure, where the lights going across in front of the runways and things. So that's what this is composed of. And we have all-weather roads that lead to these different facilities, and they made some changes, which added quantities to it. So you can see the itemized list there, and some added drainage pipe because of some of those changes. which resulted in that total. Now, the FAA has reviewed this as well. In fact, they made a lot of requests as a part of this. And we've talked to them pretty carefully about keeping control of change orders, and I'm hoping, and I really feel pretty confident, this will be the last one of its type, because the project now has been flight checked, certified, and I know that there's a lot of documentation that FAA will have to complete, and then we hope to bring this online real soon. So this is almost like a reconciliation change order, but I don't really expect any other changes from this point on. Any questions?
Any questions for Davis?
Davis, you said you apply for funding from FAA after the...
Actually, in this case, our grant budget, the grant that we have that's been allocated for the project, it fits within that. So really, we came in under budget on our bid. So we had a little bit of a surplus. And you'll notice too that there was a previous change order that we had that what was part of the work being done by J.R. Jones was really assigned in a scope from a previous contractor, but because of equipment delays, it made sense to pull that money off of that contract and add it into this.
So who have you got behind you?
This is our engineer, Jonathan Farmer. He's with KSA Engineers, and he's our design engineer. And I thought, well, any other questions you may have that are beyond my scope, I had him here for some backup.
Any questions for Jonathan or Davis?
Move to approve M4.
Second.
Motion by Wynn, second by Sellers. Any further discussion? All those in favor say aye. Aye. Opposed? Motion carries. Thanks, guys. Now we're going to board appointments. Cassandra, are you doing this? Pardon me? Or me just do it?
Yeah, I mean, I'll just go over the notes then, and Cassandra can back me up on whatever it was that was on here. So the Tyler Industrial Park is designated as Tyler Increment Reinvestment Zone number 1. This is, the City Council has representatives on there. Your representatives last were Dean Cagle, Fred Carl, and Billy Hibbs as 3 of the 6 representatives on there. All 3 the terms for these 3 representatives began January 1st, 2019, expires on January 1st, 2021. On January 22nd, 2020, the City Council also appointed Dean Cagle as chairman of the Board of Directors for a 1-year term from January 1, 2020 to January 1, 2021. The Tyler EDC is requesting that the City Council as administrator for the zone reappoint these or other representatives and to reappoint Dean Cagle or as another representative for chairman of the board. The new membership terms for these 3 representatives will be January 1st, 2021 to January 1st, 2023. The new chairmanship term will be from January 1st, 2021 to January 1st, 2022. And the recommendation from the Tyler EDC was asked if you could reappoint those members to those different seats.
Does someone want to make that motion?
Move to approve B1.
Second.
I've got a motion and a second. All those in favor say aye.
Aye.
Opposed? Motion carries. All right, next we've got the consent agenda. Any items need to be pulled off this?
Move to approve the consent agenda as presented.
Second.
Motion by Westbrook, second by Curtis. Any further discussion? All those in favor say aye.
Aye.
Opposed? Motion carries. City Manager's report.
Thank you, Mayor and Council. My first, as far as item I have that I want to mention is just kind of a hats off and a deep appreciation to our public safety and streets and traffic crews during this most recent snow and ice storm. They begin preparing the week ahead as the weather, we start to see the weather and really can start to evaluate it, and we're on standby and ready to go when the snow started hitting the ground on Sunday morning. The streets crews addressed 68 different tree-related issues related to winter weather. These are trees crossing streets, causing inability to move. They were able to keep the roads sanded. We have a plan that we've worked through to make sure that we hit many of the different high kind of as far as use areas, and especially the hospitals, to keep those open at all times. Tyler Pounds Airport, it's Davis is back there, and he and the streets crews also just did an incredible job of keeping the airport open. And so while the snow was falling, while some other airports were struggling, they were able to keep as far as just activity going, and then by Monday, it was still business as usual with the work that they put into it. We have all the power restored now to the traffic signals throughout the city. There were 3 of them that were down, but because of available shared resources, we were able to get a generator to make the one that had the most amount of traffic, which was Troop in the Loop 323, functional until Encore was able to get the power restored. And then, of course, fire department, there were numerous, as far as house fires or other air emergencies that popped up, and they just did an incredible job of running throughout the night, going to different places and making sure that people were safe and that property was taken care of as best as possible. So just, like I said, a deep appreciation we have for these men and women who just jump in at a moment's notice and take care of our people in Tyler, so that they can enjoy their snow day and not have to worry about getting hurt. A few things. So the weather now is beautiful, and this weekend also looks beautiful. Parks Department encourages people to get out and enjoy this. We have 4 out of 10 new bicycle fix-it stations that have been installed already, and the others are coming up. These are along our trails. Legacy Trail and Faulkner Bike Trail have some of these out there. Arbor Day is coming up this weekend with strict COVID precautions that are being taken, but registration can be done on that, so people can partake in Arbor Day festivities. And also the Glass Recreation Center is having their New Year membership drive and offering annual memberships for only $25. So we encourage people to, don't lose out on those resolutions yet. You have the opportunity for a cheap price to keep it going. And then finally, the police department. I want to say, just as far as they have done an amazing job on recruitment and hiring recently. They are at 100% staffing for authorized positions, which is an amazing feat for any police department nowadays. And so they have currently 2 officers that have entered the PTO program, the field training as police officers, and 14 cadets that are attending the police academy currently. And so we're looking forward to all these amazing officers out there on the streets taking care of our citizens. So with that, Mayor, turn it back over to you, sir.
Thank you, Ed.
I do have one question for Ed.
Yes, sir.
Ed, I noticed we've got banners up on all of the fire station properties about requesting, if you're interested, please apply. So what's the response of those?
I haven't heard the response yet on that. That drive is currently going on. You're exactly right, and this is a major change for the fire department. We had there used to be the process up until this very drive that Councilman Westbrook is referencing, was you had to be a certified firefighter in order to apply to come work for the Tyler Fire Department. That was a change. It's probably been around for about the past 15, 20 years. But many of our firefighters that had come on back in the old days that are still around came in as electricians or just out of high school or whatever, and didn't have the certification piece. And that was one of the things as we hired, especially Chief Coble, was in talking to them about what are some of the things that we can do to really increase the ability for diversity as far as, and also try to see what we can do to appeal to more women to apply for the fire department. And this was one of the things that they recommended was open it back up again, and then we'll do the training piece. And so that's where this is the first session we've had of recruitment drive that is just, it's the same now, it's the same as police department, where you do not have to have certification to apply for our fire department. You apply, you go through the testing and all, still have the civil service exam and all, but then we then, kind of based upon how you do on the test, physical fitness tests and all, then we go and hire you and recruit you or train you and put you into service. So you get your certification through us now.
Wow, thank you.
But as we get some more details on that, I most definitely will share that with Mayor and Council on how those recruitment is going.
Mr. Mayor, I have a couple of things I'd like to say. First, thank you for mentioning Arbor Day on this Saturday. I will be out there with them at Woldert Park. And the Landowners Association actually purchased a tree to plant in honor of Constable, the late Constable Henry Jackson, as well as one will be planted for the late former Councilman Ed Moore on Saturday. And then secondly, Mr. Mayor, I know we said we didn't make any comments in regards to the comments that was made by Mr. Bonner, but I want the public to know that we're working closely together at this council and the city members here to try to make things better for us here in Tyler. And so I want him to know that we're working closely, I'm working closely with the council and with the mayor, as well as Councilman McGee, that we recognize that there are issues, and but we're working to make sure that those issues are getting better for the city of Tyler. And I just wanted to bring that forth.
Well, Shirley, thank you for those comments. And the last thing I'm going to say is I'm a kid. Sunday after, when we got out of church, we walked out, and I mean, it was snow flurries. And, you know, as crazy as this world is, you know, when you walk out and you see it snowing like it was, and Shelley and I drove around town later that afternoon, and you see all these kids out there making snowmen and just playing out their yards. And you look at Facebook and you see people posting their families throwing snowballs instead of all this craziness that we see on social media. I'm just going to say it was just a breath of fresh air, and it's just kind of a nice new beginning to 2021. So it was a good day for my family. I hope it was a good day for y'all's. We do have executive session. We do expect or should have some action. Should take about 10 or 15 minutes. The City Council may go into executive session regarding any item posted on the agenda as authorized by Title V, Chapter 551 of the Texas Government Code. Notice is hereby given that the City Council may go into executive session in accordance with the following provision of the Government Code. Executive item under Texas Government Code Section 551.072, Real Estate, the deliberation regarding the following. Discuss the purchase, exchange, sale, lease, or value of real properties, the public discussion of which would have a detrimental effect on the negotiated position of the city. Any final action to be taken by the City Council will be taken in open session. So we're going to go to executive session. We'll be back in a bit.
Can I quickly introduce them? 11:03, thank you.
Favorite answer question.
Bob, you back there? All right, we are back from executive session, and I believe we do have action. So if someone would like to make the motion.
Yeah, Mr. Mayor, I have a motion to make. I move to authorize the city manager to execute all documents necessary to purchase the property located at 621 West Ferguson, Tyler, Texas.
Second.
A motion by Curtis, a second by Westbrook. Any further discussion? All those in favor say aye. Aye. Opposed? Motion carries.
And one other thing, Mayor, I'm sorry. Going back to R2, I have to say that we've tried to get confirmation that we actually had both a motion and a second and a vote. So I'm just asking to ensure that we have it cleared up in our records, that we go back to R2, we ask for a motion, second, and a vote, just to ensure.
And R2, by the way, was as far as requesting the city council conduct a public hearing under Texas Local Government Code Section 372.009 to consider acceptance of a petition from Bellwood 323, 2019 LP to create a public improvement district and consider adopting a resolution creating the West Side Place Public Improvement District within the city of Tyler, Texas. And so this was on the petition, accepting the petition.
Move to approve R2.
Shirley?
Second.
Got a motion by McGee, a second by McKellar. Any further discussion? All those in favor say aye.
Aye.
Opposed? R2 passes.
Thank you so much, twice. Yes,
I think we're done. Can we get a motion to adjourn?
So
Make
moved.
motion to adjourn.
Hey, we got a
So
motion.
moved.
We're out of here.
And council, before you leave, y'all come up, please.